Hey, everybody, welcome. We have just a couple more minutes before the workshop starts. It is super interesting to me to be doing this hybrid model where I'm doing a Zoom meeting, but there are also folks there live in person in a room. Welcome to you all. I did my first in-person conference since the pandemic last week, and it was a little disconcerting in the beginning, but ended up loving it. So I hope you guys are enjoying yourselves there, learning a lot. Wish I could be there with you, but happy to have you here in this virtual hybrid setting. Hey, everybody, welcome. Welcome, welcome. So happy to see so many of you there in the live room, and great to see folks joining us virtually on the Zoom. We'll go ahead and get started. My name is Mindy Mitchell. I'm a directing attorney with HomeBase, which is a technical assistance, consulting, and strategic planning firm in San Francisco. I am actually located in Baltimore right now. And I'm not sure how the live room is going to work for introductions. So Zoom folks, this might be just for you. Hey, Angel, welcome. You're in Baltimore. You should email me and we'll have coffee. I have all the fancy coffee places in Baltimore are now under my belt since I've been living here. Let's go ahead and get started with introductions. A lot of you may know me from my time at the National Alliance in Homelessness. I was there for quite a few years, worked on a lot of different policy parts of the job, and also with our capacity building team doing technical assistance. I like to do the icebreaker on this one with talking about, tell me a little bit about yourself and whether or not you're a cat person, a dog person, a both or a neither or a multiple. Again, I don't know in the live room how this is going to work. I didn't plan this through. If you guys are also on the Zoom chat, then you can put in the Zoom chat. But for folks on the Zoom chat, cat people, dog people. Hey, Michelle, welcome from Utah. 2 dogs. Yes, the slides will be available to everyone through the app, the Whova app. Yes, cat. Cat is also a cat person. Great. As you guys can tell from the picture I put on here, and if you've been on any Zooms with me in the last couple of years, I am a cat person. I have 2 deaf cats. They're both white. And they're just lots of fun. They're actually sleeping right now, so you probably won't have to see them, although you maybe want to see them during the presentation. Oh, I'm loving seeing all these cat folks in the chat. Welcome. Andrew is an equal animal pet opportunity person. Welcome, welcome. John's dog is the size of a cat. Folks there in the live area, I wish I could hear you all, but maybe if you raise your hand, if you're a cat person, I can see you from the back. Oh, I see a cat person. Yeah, hey, welcome. And how about dog people in the audience there? Raise your hand. It's always the case with live audiences. There's a lot more dog people. Welcome to you all. Again, if I could hear your audio there, I would ask you if you were others, and there have been lots of interesting others among our audiences, but since we're in this weird hybrid world, continue to post in the chat, and we'll go ahead and get started. First, we have a poll. So I'm going to ask my assistant to run the poll. For folks on Zoom, again, I don't know if folks there in the live audience will be able to do this unless you're also signed in on Zoom. So how long have you been working in our field? See some answers scrolling in. I know we have had lots of new folks join our field as a result of all the funding that we have available through the COVID relief funds. And so I am seeing a lot of, almost half of you, at least on the Zoom poll, have been in our field for 6 months or less. So that is really great. This is a good workshop for you. I also see this happens in all the Homelessness 101s that I do. There are folks with over 3 years experience, and I'm glad to have you here. It is always good for all of us to kind of touch base on the basics. But when I say 101, this is going to be super 101. So if you guys are, those of you who have more experience in our field, I don't want you to leave. I love having you here, but it will be a 101. So just heads up on that. Again, I have a Zoom poll here, and I can see you guys in the live audience from behind. So folks in the live audience, raise your hand if you have 6 months or less experience. Okay, great. And 6 to 12 months. Oh, I see the camera moving. Thank you. How about folks in the live audience with 1 to 2 years experience? 2 to 3? 3 or more? Okay. Glad to have everybody here. Glad to have this wide range of experience. Sharing the results real quick on that poll. And let's go on to the next poll. This one is, what is your role in the homelessness field? You can check as many as apply. Have quite a few options here, and I know a lot of us wear multiple hats. And we all have a role to play in ending homelessness in our community, and that's part of what we'll talk about today in this 101 session. Okay, watching the poll results coming in. Lots of us are advocates. I hope that even though we don't officially work as advocates, whatever hat we wear, we're also advocating. Okay, still have a few responses coming in. And folks in the live room there, raise your hand if you're an advocate. Yes, nice, nice. And how about folks in the live room there, frontline staff folks? Any frontline staff? Folks who are system leaders, COC leads? Welcome, welcome. Data administrators, any of the data folks in there? Saw a lot of you at the data conference last week. Folks from local or state governments? Welcome, welcome. Any folks from mainstream systems? You guys are folks that we all want to be working with. So folks in child welfare, income support, employment, other folks, raise your hands. How about folks in healthcare? Peer supporters, welcome, really, really important job. Anybody working in philanthropy in the room? Yes, love those private flexible dollars. Other folks? Okay, I'm going to end this poll. Looks like we have a lot of folks from local and state government. Really glad to see y'all here. I know you've had a lot of money flowing in to address homelessness. So I hope that I'm able to help you think about how to do that. And a lot of folks who are advocates. Really great to have you guys here. Okay, we'll go ahead and get started. Again, this is a hybrid model. I am not quite sure how it's going to work for folks in the live room if you have questions. If there is someone from the events staff there who can ping me on the Zoom and let me know. In the meantime, everyone who is on the Zoom, If you have questions along the way, just post them in the chat. We'll get to them. I have a lot of content here. Won't be going through it all. I like to make sure that you have a lot of content in the slides, even if we don't get through it all in the presentation. So welcome everybody, and we'll go ahead and get started just briefly talking about homelessness in America and a little bit about in California. So I like to start these conversations with really thinking about what causes homelessness. And it is not necessarily what you think. At its core, at its foundation, homelessness is a result of how much it costs for housing and how much somebody has to pay for housing and the mismatch between those two things. It really is about not being able to afford housing in our community, and that is a function of poverty. So when you guys get the slides, you will see the link here that goes to a great report from the National Low Income Housing Coalition. Last time I checked, there were exactly 4 counties in the whole country, 4 counties in the whole country, and there are thousands of counties in our country, where someone making minimum wage, the federal minimum wage, could afford fair market rent, right? So this is really the essence of homelessness. There are other things to consider that increase the risk of experiencing homelessness, but remember, risk of homelessness is not actually a cause of homelessness, and it really does come down to that mismatch between how much housing costs and how much someone has to pay for housing. Some of the risk factors include racial inequities, especially throughout other parts of our system, including overrepresentation in poverty, in the criminal justice system, in the child welfare system, and how all of those contribute to people experiencing an increased risk of homelessness. It's also about having access to health and health care. And again, this is a function of poverty, because if you don't have access to health care, good health care, health insurance, which has improved for a lot of folks because of the Affordable Care Act, one health problem, one health emergency happening can really knock out your ability to pay for housing. Having mental or behavioral health issues, including serious mental illness, substance use disorder, dual diagnoses, all of those can contribute to the risk. Experiencing interpersonal violence, whether that is domestic violence in a partner relationship, can also include things like being trafficked or engaging in survival sex. All of that facet of interpersonal violence can contribute to someone experiencing homelessness. Like I mentioned earlier, being involved in other systems, like the child welfare system, the justice system, can increase the risk that one experiences homelessness, especially when leaving those systems, and just conflict with family and people that you're sharing housing with. The big but here, though, is all of those risk factors, people across all income levels experience those risk factors, but never become homeless, because even with those risk factors, even with those crises, they have enough resources to weather, right? And they don't become homelessness. So again, bring it all back to homelessness is a mismatch between how much it costs for housing and how much someone has to pay for housing. Really briefly here, just going to run through some data. You guys can explore this a lot more. There are links to all of these slides and reports in the slides when you get them. This is just the 2020 data from the point in time count, which captures folks on a single night who are experiencing sheltered and unsheltered homelessness in our country. So this is a minimum. This is a baseline. There are lots of other data sources that you'll hear about at the conference and in your work. But this gives us a kind of oranges to oranges every year to look at to see trends. What I want you to see here, especially, this is a great resource from the National Alliance to End Homelessness, the State of Homelessness report, is that individuals experiencing homelessness are most likely to be unsheltered, along with unaccompanied youth, except for chronically homeless folks, which we'll talk about in a little bit. Another great resource from the National Alliance to End Homelessness is in the State of Homelessness report, and what I've linked to here and that you'll have in the slides is a really good data set of who's experiencing homelessness in California. When you go into this report, after the conference is over, you can look up the continuum of care that you live in. and get great data on where you actually work in California. Again, some more data from State of Homelessness about who's experiencing homelessness in California. This is a good chart for seeing the trends in homelessness. As you can see, everywhere has gone up, especially as a result of the pandemic, which is not surprising. And you can see this broken out by different populations, which we'll talk about in a little while. So speaking of populations, it's really helpful when you're thinking about addressing homelessness in your communities and how to distribute resources fairly and effectively is to think about the different populations experiencing homelessness. I always start this conversation with individuals experiencing homelessness. These are folks, predominantly men, who are not part of special populations like people experiencing chronic homelessness, veterans, or youth. All of those groups have resources dedicated to them, but this largest group of people experiencing homelessness have the fewest resources dedicated to them. So if you're thinking about in your community how to really move the needle on homelessness, you have to think about how to get resources to this group. And by the way, it's a matter of equity because Black and Indigenous people of color, especially men, are overrepresented among this group. This is also, like I said earlier, a group of folks who are much more likely to be unsheltered. And the solution for them is housing, just like the solution for everybody, right? Also think about when you're addressing homelessness for these folks, making sure that you're getting folks connected to employment. Think about making connections to recovery. And for folks who are exiting the criminal justice system, connecting them to reentry resources. Another thing to think about with this population particularly is that it's an aging population. I have linked here, and again, you'll get the slides, to a great report from Dennis Culhane, a longtime researcher on homelessness in this country, that looked at folks in 3 communities, Los Angeles, Boston, and New York. There is a cohort effect among people experiencing homelessness, especially individuals, and that they are getting older and they are experiencing all of the needs that come with getting older, but at a younger age, because homelessness itself is really hard on the body. So you guys may have heard in your communities that when someone has been experiencing unsheltered homelessness for a long time, they often have the health issues, cognitive issues that folks much older than them who are housed have. So just something to keep in mind too when we're thinking about this population and thinking about how to distribute resources. Another really important distinction, if you're just getting started in this field, is you hear about chronic homelessness. So this is a very specific definition that comes from the Department of Housing and Urban Development, but at its simplest, being defined as chronically homeless requires the presence of a disability. Folks who are experiencing unsheltered homelessness or living in an emergency shelter. And the chronicity part is that they have been homeless for at least a year or 4 times in the past 3 years, totaling up to a year. The really important thing about addressing chronic homelessness is this is a small group of folks, but they're really vulnerable because they've been homeless for a long time and because they're experiencing homelessness with a disability, often multiple disabilities. There are really high public costs for these folks remaining homelessness if we're not getting them housed. The next important group to think about when you're understanding homelessness is veterans. I like to talk about veterans because very specifically, the progress that we've made on veterans homelessness in this country shows us that this is possible for everyone experiencing homelessness. To date, 83 communities and 3 entire states, including the state of West Virginia, which is a big state with rural areas, urban areas, suburban areas, have ended veterans homelessness. So this shows us that this is possible. Most people experiencing veterans homelessness are actually not in families. There's a small group of veteran families. Again, overwhelmingly male. There is an older cohort effect, especially for folks who were Vietnam veterans, are Vietnam veterans. The thing that veterans homelessness shows us is that this is possible, and the way to do it is that we have adequate resources, right? You guys have heard me probably say multiple times, Democrats and Republicans love veterans and they love funding things for veterans. So this has been an opportunity for us to say to Congress, if you put enough money behind this, we can actually move the needle on this problem. But something to keep in mind on veterans homelessness is that everywhere in the country got enough resources for veterans, but not everywhere ended veterans homelessness. So it's about more than resources, and it's about developing what we call a coordinated, systemic, housing-focused response to homelessness. And I'll talk a lot more about that in a little bit. Another really important population for addressing homelessness in your communities is thinking about young people experiencing homelessness. This is another subpopulation that has a really high rate of unsheltered homelessness. Young people are not that different from everybody else experiencing homelessness. One of the ways that they are different is that when we're thinking about preventing homelessness, they have special prevention points, including schools, and really importantly, the child welfare system. Young people who are in foster care, and especially aging out of foster care, have a much greater likelihood of experiencing homelessness. So that involves our communities, especially at the county level, thinking about how we can prevent homelessness for them. Another really important part of youth homelessness is that often young people experiencing homelessness as a result of a conflict with their family. Something blows up and young people get kicked out. So intervening with families and doing family reunification is a really important part of addressing youth homelessness. Young people need access to low barrier crisis responses, and I'll talk more about that in a minute. We really need to ramp up our permanent housing first response for young people. And like all people experiencing homelessness, we have to think about this from a system perspective and not just a program perspective. Family homelessness, this is actually only about a third of people experiencing homelessness, but they're vulnerable because they have young children. About half of the children experiencing homelessness in families are little bitty kids under 5. One good thing about family homelessness is this is the population that is most likely to be sheltered and to have the most resources dedicated to them. We are making good progress on family homelessness, with the exception of an uptick since the pandemic, which is not unexpected. But the progress has been uneven across states. Again, you guys will get these slides, lots of good linked resources in here, especially from the National Alliance to End Homelessness, where the Homelessness Research Institute has done a lot of analysis about how resources are getting spent. And just really quickly, the image here is from one of those levels of analysis for the entire country about where we have resources allocated. And when we talk about right sizing our system, you guys should be looking at in your community, I have X number of people in different populations experiencing homelessness, and I have Y number of resources dedicated to those folks. Most communities have more resources dedicated to families than they actually have families experiencing homelessness, and fewer resources dedicated to individuals than they have individuals experiencing homelessness. So that's part of thinking about how to right size your system. Ending homelessness. Let me really quickly check the chat. Oh, Jacqueline, thank you so much. You guys, Jacqueline Ramirez is in the back of the room. And she can add questions from the live audience. So if you guys have questions, raise your hand. Jacqueline can come and get your question. John, I see in your chat that you asked for the link in the chat, please. I don't know if I have the capacity to do that from my end. Let me see. I may not have. I may not have that. Okay, yeah, thank you. Everybody, you'll get these slides and you'll have access to all of these links. Okay. Jacqueline, I think I saw you move. Was there a question? Okay, we'll go ahead and move on. Okay, ending homelessness. So you might have guessed this just from my intro here. What ends homelessness? It is not rocket science. It is housing. Housed people are not homeless. So first and foremost, always bring it back to housing. However, like I said, with veterans. We had enough resources for housing for veterans in every community, but not every community ended veterans homelessness. So that tells us it's about how we're using those resources. So we have to really develop an efficient, effective, really fast crisis response to homelessness. We have to do this in a coordinated, community-wide, systemic approach. And we have to make sure that we're getting folks connected to income resources so that they don't return to homelessness after we assist them. Really quickly, again, this is a 101. So for folks who have been doing this a little bit longer, this is going to be some basic stuff. When we're talking about ending homelessness, there are kind of two buckets of major interventions. We have temporary interventions and we have permanent housing interventions. So temporary interventions are, of course, things like emergency shelter. One thing to know about folks who experience sheltered homelessness is most folks who come into shelter actually are there for less than a month and they don't return to homelessness. Then we also have a temporary intervention called transitional housing. This can go up to 2 years. One thing to note about transitional housing, though, and the reason why it's called a temporary intervention is it is usually run by a program. Often the housing itself is owned by the program. The program decides who can get in and who has to leave. It's not your own housing, right? That's not to say that there aren't some funding streams called transitional housing that actually just pay for rent. But when we think about transitional housing, traditionally, it is often a congregate setting, often not low barrier. And all of the research to date has been about that traditional approach to transitional housing is generally more expensive than just helping folks with rental assistance. And it has about the same or better outcomes when you just help folks with rental assistance. Which brings me to the first permanent housing intervention, rapid rehousing. This provides short to medium term rental assistance, which can go up to 2 years and even longer now with some of the COVID waivers. This is rental assistance, but not just, and we'll talk more about that later. It's also helping folks find housing and providing case management services while they're in housing and connecting them to supports afterwards. Another important permanent housing intervention is permanent supportive housing, also called PSH. You'll hear it referred to as that. This is a permanent, potentially rest of your life, as long as you're income eligible, housing subsidy, a voucher, plus intensive services. This is often a very expensive model, so it should be carefully targeted, especially to folks who are experiencing chronic homelessness. You guys who have been through my presentations before have seen this. This data is, as you can see, it's from FY 2015. I put this on here just to have us thinking about how we are allocating resources in this country and why we are experiencing homelessness related to that. So this is where you have on your advocacy hat and your advocacy that you're going to do at the state and the national level on homelessness. You can see here that discretionary spending is only 30% of our federal budget. And then within that little discretionary spending, the housing and community development budget is a tiny, tiny piece of that. These proportions haven't changed much since 2015, which is why I still use these charts. And then if you look at that little housing and community development, tiny little piece, another tinier piece in there is the dedicated funding at HUD for homelessness, right? So we are getting what we pay for in those terms. Here you can see this discretionary assistance for housing assistance, discretionary housing assistance has continually decreased. And that's where we started seeing homelessness increase, right? Now I'm going to give you guys just a little bit, especially if you're brand new in this field, you'll hear a lot of acronyms. The most important ones are related to funding. So I'm going to tell you a little bit about those. This is from the FY21 budget. I haven't updated it for FY22. And since I'm not in policy anymore, I'm not sure we even have that. But this is just general homelessness assistance. I'll talk a little bit more about COVID-specific homelessness assistance. Azraeli, I see in the chat that you're asking, do undocumented folks qualify for housing vouchers? If not, did they qualify if they have kids who have citizenship? I actually know the answer to this, so I'm going to go ahead and answer it because I had a question this morning. So for emergency housing vouchers, which we'll talk about in a little bit, and housing choice vouchers, you have to either be a citizen, be an eligible immigrant, and there's a list of folks who are there, or have someone in the family who is one of those, and that's who's eligible for housing vouchers. And Azraeli, if you can follow up with me by email, I can give you more information on that. So again, when you're talking about funding and the different acronyms, the big ones that you guys will hear about probably in your communities is the COC. That's a Continuum of Care. This is a really interesting way of doing federal funding. It's a competitive block grant. Almost everywhere in the country is geographically part of a COC, and it's a local collaborative, right? Like it's specifically funded to bring a lot of people in the community together and to apply for funding collaboratively in a competitive way based on performance measures, which we'll talk about in a little bit. The COC is responsible for the HMIS, which is the Homelessness Management Information System. That's how you gather data on people experiencing homelessness in your community and how you measure performance. And the COCs operate coordinated entry, which we'll also talk about in a little bit. Another really important funding stream that you'll hear about is ESG, that's Emergency Solutions Grant. This is a formula grant to states. You guys, especially, and some of you may even have new jobs as a result of this funding. There was a lot of extra ESG money to address coronavirus, especially for moving folks out of congregate shelter into non-congregate shelter and increasing rapid rehousing. So a lot of folks in California, you may have seen me before on webinars that the California HCD has been doing with this ESG CB funding. Another really important funding stream talking about veterans homelessness are HUD-VASH vouchers. These are the voucher part of HUD-VASH, which is Veterans Administration Supportive Housing. Yes. And there's a lot of money. Again, Congress is really committed to funding things for veterans experiencing homelessness, and that's really great. Another reason why I ask for philanthropy when I look at the audience is that private foundations, individual donors, all of you in your community know about this. It's actually a really big part of our national and our local efforts to address homelessness. So never, ever forget about accessing those funds because they're flexible and you can do a lot with them. There's some other federal agencies that play a really important role in ending homelessness listed here. I won't go through them all, but these are all homelessness specific funds that are available in other federal agencies. So in the Department of Health and Human Services, the VA, some other ones here, the Department of Education. Emergency Food and Shelter Program is part of Department of Homeland Security. There's Domestic Violence Transitional Housing at the Department of Justice. This is one of those transitional housing funding streams that actually can be used for rental assistance. And Homeless Veterans Reintegration Project is through the Department of Labor and pays for assistance for employment services. This again is a year old, but I think things probably haven't changed that much as far as proportions. It's California specific. And you can see here that housing is just unfortunately a really tiny piece of this. COVID-19 resources. You guys, we could spend a whole day going through all of this. I just want to, this will be linked again in the slides. You can go through all of this. There is so much funding out there. But really importantly for people experiencing homelessness, this slide and the next slide, the Emergency Rental Assistance Program and the Emergency Housing Choice Voucher Program. Both of these can and should be targeted to people experiencing or at risk of homelessness, and they can have a really important impact on homelessness in your community. And so that's what this next slide is about. Again, there's another great resource here from the National Alliance to End Homelessness, the Homelessness Research Institute there that crunched the numbers. This is a link in the slide. Depending on how you allocate just these two funding streams, ERA, Emergency Rental Assistance, and EHV, Emergency Housing Vouchers, to people experiencing homelessness, you can potentially end homelessness in your community. So getting back to what we'll talk about and what I talked about already, thinking about things from a systems perspective, working collaboratively, focusing on ending homelessness, this is what an impact that kind of thinking can have. Okay. Any other questions? I want to make sure that we're including the folks in the live room. Okay, I'll go ahead and move on. So first I want to talk about definitions of homelessness and do some reality checking here. So it's really important that we understand the different definitions of homelessness. And I always start this conversation because there's so much misinformation about the different definitions of homelessness is you might hear folks in your community talk about the McKinney-Vento definition. What they're talking about is the education definition. There are actually two different definitions of homelessness just in the McKinney-Vento Act. So there are actually two different McKinney-Vento definitions. And it's really important when we're thinking about definitions to think about why there are different definitions. So for those of you who, like me, have been to law school, you learn really quickly that laws are written. There's always a section for definitions. This is a way that the lawmakers, in this case, Congress, are letting judges and administrators know, hey, this is what we mean when we say homelessness in this context. So in this country, education is a public right. Every child has the right to free public education. Unfortunately, housing is not the same kind of right. Would that it were, we would be in a whole different situation as far as homelessness goes. But because there are those two differences, education is a right that every child has. Housing is not a right. It's a scarce resource. And we clearly have seen from the previous slides that we don't fund it enough. Right? Congress wanted to make sure that the definition of homelessness for HUD was more stringent than the definition of homelessness for the Department of Education. So it's really about eligibility, not so much about being defined as homeless or not homeless. And now I have a cat. So here's the HUD definition really simply. There are 4 categories of homelessness within the HUD definition. The first one is literally homeless. So this is folks who are unsheltered, staying in places not meant for human habitation or in emergency shelter. The next one is imminently homeless. So this is folks who are 2 weeks or less away from becoming literally homeless with no other options. A third category in the HUD definition is folks who are defined as homeless by other statutes and agencies. And then finally, people who are living in unsafe situations. This can be folks who are experiencing domestic or interpersonal violence, but it also includes folks who are trading sex for a place to stay, survival sex, or folks who are being trafficked. So you can see here, the HUD definition actually includes all the other definitions. So it's not really so much about being defined as homelessness, it's about what you're eligible for. So, don't spend a whole lot of time trying to read all the tiny text on here, but what I'm trying to show you here in this flow chart is about you're asking eligibility questions because you have this scarce housing resource, right? So the first question that we're asking when we're trying to determine if folks are eligible for HUD specific homelessness funding is, are you safe? If folks are not safe, they're in category 4, they're actually at the front of the line and they're eligible for all of the homelessness resources, almost all. If folks are safe, but they are outside or unsheltered or sheltered, living in an emergency shelter, they're in category 1. That's literally homelessness. And they're eligible for, again, most HUD homelessness resources. If someone is not outside or in shelter and they're staying somewhere else safely, you ask, how long can you stay there? If it's less than 2 weeks, that's category 2, that's imminently homeless, and you're still eligible for HUD homelessness assistance, but fewer things, right? And then finally, category 3 is folks who are included in other definitions, but don't fall into the previous ones. So you can think about this in a way as it's generally folks who are living in safe situations with other folks, but can stay for longer than 2 weeks. They're eligible for fewer resources in the general HUD funding scheme, but all of these folks are eligible for more than HUD resources. So you're always thinking about, what are my local resources, my state resources, what are resources from other federal agencies that I can get these folks connected to? And oh, by the way, all of these folks are eligible for this wider variety of COVID assistance. So just to recap, these are the folks who are not eligible for most of the homelessness assistance through HUD, the COCs and the ESGs, not COVID related. And this is category 3. So they're staying on someone's couch, but they can stay there safely for longer than 2 weeks. They're living doubled up with family and friends for longer than 2 weeks. Folks who are living in sober living homes, or folks who are staying in motels that they're paying for by themselves and that they can pay for longer than 2 weeks. So we'll do a little myth busting. I like to do this one. Folks in the audience, you can raise your hand and yell it out and Jacqueline can type it in, or folks on Zoom, you can put it in the chat. Are couch surfing youth eligible under the HUD definition? This is a little bit weird. I feel like I'll probably need to answer my own question. They actually are eligible under category 2. Thank you, Jose. They're eligible under category 2. Most young people who are couch surfing can't stay where they are for longer than 2 weeks. If they can't stay for longer than 2 weeks, they're eligible under category 2. If they can stay on someone's couch for longer than 2 weeks, that's category 3. And there's not a whole lot of the HUD funding assistance that they're eligible for, but there are those other resources. Okay, Mythbusters number 2. Are people trading sex for a place to stay or living with traffickers included under HUD definition eligibility? I think I can hear the audience. Oh, this is exciting. Yes, they are. They're actually kind of quote unquote at the front of the line. They are not in safe situations. So they are included in category 4 and eligible for all of those resources, except for some of the PSH resources, which require chronic homelessness. Okay, Mythbusters number 3. How do these different definitions relate to the point in time count? This is a trick question because I didn't talk about this, but this is where people often get hung up on the definition and have a lot of feelings about people not being defined as homeless. But what we're looking at the point in time count is just that category 1, right? So point in time count just captures people who are unsheltered or living in shelter, right? And those folks are category 1. The point in time count does not capture everyone who is eligible for HUD homelessness assistance. It would be kind of impossible to do that on one night. You would have to go door to door and kind of knock on doors and say, is there someone staying here who has to leave in less than 2 weeks? Is there someone staying here who has to leave in more than 2 weeks? Is there someone staying here who wants to flee a domestic violence situation but hasn't left yet, right? Like that's not something you can do on a single night. This is why it's really important when you're looking at the data in your community that you look at multiple data sources, not just point in time. Point in time tells us a lot about those folks in category 1, but other data sources, including your, you have AHAR, which is AHAR 2 in federal language, which captures folks over the course of a year experiencing homelessness in your community. You also have other data sources from other agencies that you can look at and find out who is at risk of homelessness, who is in these other categories and defined as homeless by other agencies, including schools who don't fall into category 4, 1, or 2. Okay, I'll stop again. Anybody have any questions, any thoughts before we move on? Oh, thank you, Alma. Point in time, PIT is point in time count. This is a requirement for continuums of care, COCs. And they have to conduct it at least every other year to try to capture the data for folks who are experiencing unsheltered homelessness, particularly really hard group of folks to capture and count. And there's lots of improvements that can be made on point in time night, including to make sure that we're capturing people experiencing unsheltered homelessness in communities of color. So we know that this data is not perfect, but it does give us kind of a year to year, apples to apples to look at to see if we're moving the needle on unsheltered homelessness particularly. Any other questions? Sure thing. I'm here, Alma, just let me know. Okay, we'll go ahead and move on. So you guys, it's so not exciting, but it's really how we move the needle on homelessness, this effective homeless response system. I can't say it enough. As you're doing the work that you're doing in your community, it's really important, especially the frontline staff, provider level work that happens to get folks into housing and services. But all of that won't solve the bigger community level problem of homelessness unless we all come together as a system to address the problem. So this is what I mean when I talk about an effective homeless response system. You have that local system, right? It's the continuum of care. You're being coordinated. Everybody's working towards the same goal. You're using a housing first approach, which we'll talk about in a minute. And you're focusing on ending homelessness. That is our North Star. That's where we're all pointing to. We want to make sure that if someone is about to become homeless or they're already homelessness, we can find them, identify them, we can get them safe, and then quickly get them back into permanent housing. So when we talk about working together as a system, thinking about a system, a basic definition for system is we're interdependent parts. Each of the parts may be doing different things, but we're all working together. We have a defined set of resources and practices that we're all using, and we're working on achieving a common goal. And in the case of homelessness, that goal is that we're getting people housed. We're housing them as quickly as possible, and we're preventing them from imminent homelessness whenever we can. So the reason why we use a systemic approach, and I will, for those, you guys are kind of new here, but some of the folks have been doing this work for a while, and some of the folks at the conference have been doing this for decades, and there's a bad old way of doing things. So the way that we used to address homelessness is it was a lot of individual programs kind of doing their own thing, deciding who was going to get in. Some of you have heard me say I started this journey as a case manager at a high barrier shelter for homeless families in Mobile, Alabama. And the barriers that we made those folks jump through was just wrong. Families deserved shelter and housing by virtue of not having any. And that is how things used to be. When we shift to a systemic approach, we're no longer individual clocks in a clock store. Everybody's set to their own time. Some clocks running fast, some clocks running slow, alarms going off different hours of the day and night. We all shift to becoming a single clock, and we're all gears inside that clock, everything working towards that one time, the time that we have set our goal of ending homelessness. The bad old days, the early approaches to ending homelessness were very program-based, and those programs were really siloed. It was about just managing the problem of homelessness in our communities, about addressing homelessness for each individual person that was lucky enough to get into our programs. So in my case, the families who passed the urine test, who did well in the interview with the executive director, right? Those were the ones who were lucky enough to get into our program and to get access to the resources that we had. So we wanted to switch to a systemic approach where we're all working on ending homelessness, not just managing it. We want to significantly reduce the number, and that means at the community level, we have to all be working together to achieve that goal. And we're using our funding more efficiently when we do it this way, so that we can improve system flow. We have found over the past a couple of decades now that we've shifted the approach on homelessness to this systemic approach, that you get the best results on homelessness when you do this really coordinated, intensive focus on getting people into housing. Again, bringing it all back to what I started to, homelessness is a mismatch between how much housing costs and how much someone has to pay for housing. All of those other things are risk factors that everyone has, regardless of the income that they have, but only really poor people experience homelessness as a result of those. So it's really about doing the systemic housing first approach to homelessness, getting folks into housing first, and then providing other resources once she's housed, and that gets us good results at less cost. So again, you'll hear me talk about a lot system flow. You'll probably hear it a lot in some of the workshops while you're at Housing California. System flow means we have this efficient, coordinated process. We're getting folks quickly from homelessness into housing. When we have poor system flow, we have a stuck system. And this, I won't read all of these to you. We still have a lot of material to go, but this is what we mean when we have poor system flow. And I think when you guys look at these, you will see this probably looks like a lot of your communities. And there are lots of reasons for this. Some of these are outside of the control of homelessness programs and the homelessness system in California, particularly. You guys have a really, really serious, probably the most serious in the country, affordable housing crisis. But there are things here that the homelessness system can control to improve system flow. And we're talking about people coming into homelessness and people getting out of homelessness. And that is all a matter of how you're allocating your resources.
How we allocate our homelessness resources as a community has very real consequences for people who are homeless, especially those who are unsheltered. Depending on the choices we make, our homelessness system can have good system flow, or it can be stuck, as this simulation will demonstrate. Here we have a very simple representation of a system that doesn't have optimal system flow. It is stuck. On the left are people who are homeless and living on the street or in some type of unsheltered location. In the middle are people who are in shelter beds, and on the right are permanent housing resources. The animation shows that new people are becoming homeless. People are moving from streets to shelter as well as to housing, and people are moving from shelter into housing when there are open spots. And some people do go back into homelessness, though that isn't shown in this simulation. On the bottom, you can see that the number of people experiencing homelessness went up because the inflow of people becoming homeless is higher than the number of people that are getting housed. That is, people are becoming homeless at a faster rate than the system can house people. The people with the sad faces represent long stayers, people who are stuck in shelter for long periods of time because they don't have a way of getting out to housing. This system is stuck. When you have a lot of homeless people in the community, it's common to think that adding more shelter will help the problem. But as you can see here, the number of homeless people still increases. Why? Because if you don't increase housing capacity, people who are in shelter still have no way to exit out of homelessness. Now, rather than increasing shelter beds, this community has chosen to increase the rapid rehousing capacity of its homelessness system. This allows there to be more people flowing through the system into housing. And because rapid rehousing is a short to medium term intervention, most of these units will open up every 6 to 12 months so new people can get that housing assistance. This creates good system flow. People are no longer getting stuck in homelessness for long periods of time. And finally, for optimal system flow, communities can add carefully targeted diversion and rapid exit resources at the front door of the crisis response system. Again, these numbers are not exact, but this simple animation is intended to provide a visual simulation of how community-level decisions about the allocation of homelessness resources toward permanent rather than crisis housing solutions can improve system flow and make substantial reductions in the number of people experiencing homelessness, which should be the ultimate goal in all of our communities.
Okay. And everybody, here's one of the cats. I knew that was going to happen. Okay, so to recap, elements of an effective homelessness response system when you have good system flow. First of all, everybody across the system is practicing the housing first approach, which we will talk about in just a minute. We're diverting folks from imminent homelessness whenever possible. And by the way, all of these COVID resources are great to use for diversion. We can rapidly identify and engage people who are experiencing homelessness, get them really quickly connected to the crisis response system, the emergency shelter system, and into permanent housing. We are making sure throughout our system that there are quick, accessible, low barrier pathways to shelter and other crisis response, and that the stays in shelter are short because we're getting folks quickly into permanent housing. And finally, that rapid connection to permanent housing for everyone who is in shelter and for folks who are unsheltered. And we're doing it all in a coordinated way. And so that people have fair, coordinated access to all the homelessness resources. And that is through coordinated entry, which we'll talk about in a minute. Again, this is all for the sake of bringing us together as a community and addressing the problem of homelessness as a community and not as individual programs. So these are all the end game, right? The goal here is that we don't have folks who are unsheltered. People are homeless for a really short period of time when they are experiencing homelessness, and that they don't return to homelessness when they do get homelessness assistance. So you'll hear this at the federal government level talked about homelessness is rare, brief, and one time. So I talked about the Continuum of Care being a unique federal funding stream. It's a performance-based, kind of a collective impact model, right? And when I say performance-based, that means that your community is applying for these funds and you're getting scored based on these performance measures. So things like I just talked about, are you reducing the amount of time that people are experiencing homelessness? Are you reducing the number of people experiencing homelessness, especially unsheltered homelessness? Are you increasing income for folks? Is your number of first-time homelessness going down? Are people returning to homelessness at lower rates? These are all HUD performance measures. And then you guys in California also have performance measures for your state funding as well that really kind of mirror those performance measures by HUD. And again, these are all just performance measures that ask you as a community, are you doing well as a community on moving the needle on homelessness, making it rare, brief, and one time? Again, some of your state of California measures, the performance benchmarks.
I don't know.
I heard someone.
Yeah, I just had a quick question because I am very new to all of this. So in California,
I can't see you. Do you mind just introducing yourself? I won't be able to see you on camera, but just so I can hear you, so I know who it is.
Yeah. My name is Robert Phipps. I'm with a Fresno Council of Governments.
Hey, Robert, welcome.
Thank you. Transportation Planning Agency. But I'm just curious. So within this context, in California particularly, we have this Project HomeKey program. Now, would that be considered in terms of the continuum? Is that considered kind of permanent housing, or is that shelter?
So HomeKey happened a lot differently in a lot of different places in California. And I'm actually not a California expert, but there will be folks there and probably folks in the audience who can give you a better answer to this. But in general, HomeKey was part of a move to get folks out of congregate shelter as a result of the coronavirus pandemic, right? Because folks being in congregate shelter was not a good public health approach. So we're moving folks into motels as a form of non-congregate shelter, but then these funds can also be used to turn those motels into permanent housing. So it's both. If anyone there is California specific and knows more about HomeKey, please do share. Go ahead. I see your hand raised.
I don't know that much about HomeKey,
Okay.
but I do know that HomeKey is working.
Yes.
But I wanted
The
to talk
data is
about
really, really good. Yeah.
I wanted to talk about the continuum of care.
Sure.
I was a mental health case manager, and I work for homeless agencies, and we contracted with LA County. The problem with this continuum of care and the HMIS is when you go to the person and you ask them to answer these questions, the questions are really in-depth. They ask about a lot of personal stuff, and people are really embarrassed.
Yeah.
And they will not tell you the truth. And if they don't tell you the absolute truth, then they're going to be on a lower list to be housed.
Mhm.
So if any of you guys are working for any local, social, any type of agencies, and you're working with these people, you really need to get them to be honest. And to do that, you have to build a rapport, and you cannot look at them as you people or those people. And speaking on that, I started a small business where, I came up with a different model. Housing first doesn't work. It really doesn't, unless you have agencies that you can collaborate with that have some type of lived experience, that know how to work with people who have been in prison, who have been on drugs, who are mentally ill, and who have been chronically homeless. So when are they going to have funding, or when are they going to recognize organizations like mine that can help people, really, really help people, and have positive outcomes and keep the people housed? Because the work between, like, saying being a mental health provider or working with homeless people, you have to do notes in order to keep getting the money. So you do have to show positive outcomes, but there's no collaboration with housing, like the transitional housing, the sober livings, or the temporary shelters. People just work at those jobs and they just don't even know how to really deal with the people. So when are we going to come together with all the agencies and all the help? And really, really, that's the only way we're going to really put a big, big, big dent in the homeless problem in California. Thank you.
Thank you so much. This is a great segue to the first part of my talk now is about housing first. And part of what we say when we say housing first works or housing first doesn't work is there's a lot of misunderstanding about what housing first is. So we'll do some kind of level setting on housing first. It actually does work. When we say it doesn't work, what we're often talking about is that people didn't get a good enough services while they were in housing to help them maintain housing. And that's a different thing than saying housing first doesn't work. So we will definitely talk about that. Thank you for bringing it up. Another thing that you talked about there too, and one of the things that I'll talk about in just a little bit is I think getting to the issues with coordinated entry. Which is the thing where you're asking people really personal questions to try to get a sense of where they should be eligible, where they should be in line for getting services. And we'll also talk about that. So thank you so much for bringing that stuff up. Really, really important issues for us to come together as a community and figure out. Jane in the chat on Zoom said RBH housing. Can you tell me what RBH housing is? I'm going to take a stab at maybe recovery-based housing. Oh, okay, rehab. Housing people are given when they leave rehab. Okay, thank you. Okay, so I am not going to get through all of these, and that's okay. You guys are going to have access to the slides. Again, I always put way more content in these than we will have time to cover, but it's especially for folks who are new and just getting started, just for you to have the resources to kind of have something to touch base on. So these are the 5 elements of this effective homeless response system. And they are housing first, coordinated entry, crisis housing, permanent housing, and then stabilization supports, which is, I think, where when we talk about housing first, the problem that you guys are seeing is actually about stabilization supports. A really important thing to think about with all of this is throughout all of these, doing all of these well and committing to all of this is a matter of racial equity. We know that people of color, especially Black and Indigenous people, experience homelessness at higher rates, and they're less likely to get into our programs and more likely to experience returns to homelessness when they do get into our programs. And that says a lot about ways that we can improve, especially access to services and the services that we provide while folks are in. So, housing first, a lot of misunderstanding about what it is. It is an approach to homelessness, a philosophy across our system that prioritizes permanent housing, so it's someone's own housing, as quickly as possible without prerequisites, no hoops that I'm going to make you jump through to get into them, and then connecting you to voluntary services that you decide you need once you're in housing. There's a lot of misinformation and misconceptions about what Housing First is and is not. First of all, it's not just permanent supportive housing. That is where the concept of Housing First originated, with permanent supportive housing programs. But it has become kind of this system-wide approach to homelessness that is to be used across interventions from the emergency shelter all the way up to PSH. It really is about changing your mind about who's experiencing homelessness and what they deserve as a matter of not having any housing. Housing First is not a one size fits all. We hear that a lot too. It's actually a really flexible approach. It values and centers supporting someone where they are as an individual, honoring client choice and autonomy, and not just saying this is a program and this is how it works and this is how you have to do it. Housing First is not housing only. And I think this is where most folks, when they just throw up their hands and say Housing First doesn't work, it's because the services piece is not there and not robust enough. It is housing first. That's the first thing that I'm going to do, but it's not housing only. A lot of folks don't need services, and we tend to remember the difficult cases, right? We don't actually remember the cases, like when I was a case manager, the folks that got really quickly into and out of homelessness. Most folks actually do just need housing and just income to help them pay for housing. We come with a lot of preconceived notions based on the hardest folks that we serve, that everybody experiencing homelessness is having these same problems, and that's just not true. The data don't bear that out. Housing First is, though, about providing those supportive services that people choose for themselves, and that is a vital part of doing things in a proper Housing First way. Housing First is not setting people up to fail. First of all, that's not a strengths-based approach. And when we go into something thinking that we're setting someone up to fail, we're probably not going to support them in a way that they need to not fail, right? We've gone into this believing that they can't do it. Housing First rather provides that foundation of stability to achieve health and wellness goals that people decide they want to achieve. Most of you know about the concept of Maslow's hierarchy, right? Like if you don't have that basic of food, shelter, water, right? All of that kind of stuff, it is really hard to focus on all the other things like getting sober, like addressing your mental health needs, like finding employment. All of that stuff requires us to have a stable foundation from which to do it. Also, Housing First is not a way to prioritize one population over another. It's just a way that we center housing as the solution to someone's homelessness, regardless of the severity of their needs. So the traditional approach to homelessness, and this is in the bad old days, a lot of us still have this conception about people experiencing homelessness, is that folks need to be made ready for housing before we actually get them into housing. Housing First shifts that to saying someone is ready for housing by virtue of not having any. It again brings it all back to the response that homelessness is primarily a housing problem. For all of you that are working with folks who are experiencing severe mental illness, who are experiencing substance use disorders or co-occurring of both of those, We all know people who use substances, people who have serious mental illnesses, people who have both, including people in my own life who never experience homelessness because they have enough resources. So that is not to say that those issues are not contributing to someone remaining homeless, but it is to say that is not the cause of their homelessness. The cause of their homelessness is they can't afford housing. And when people have housing, then you can address those other issues, just like all of the rest of us do. A really important piece of Housing First, and I think this is something that makes it really difficult, especially if we're used to working in a more rules-based approach, is that we don't have prerequisites for folks getting into housing. We don't have hoops that folks have to jump through to demonstrate that they're ready for housing. A really important piece of Housing First is that folks have their own lease, just like you or I do, right? It's not the program that has the lease. It's not the program that says when you have to leave. And services are voluntary in Housing First. Again, this can be a really hard part of doing things from a Housing First approach. But the thing that I love best about Housing First is that it really requires us to think about power dynamics, right? No matter what place we are coming from, we are all coming from a really good place in doing this work. We all are, and this is wonderful work that we are doing, but inevitably, if you are a provider and I am someone experiencing homelessness, you have power over me. Housing First is a way to shift that power and balance it out and put the person experiencing homelessness in the driver's seat. So this philosophy shift, I did a lot of, for those of you who've known me for a while, I did a lot of work early on youth homelessness. And that was a field that made a big shift to embracing Housing First. And a lot of what I learned about doing Housing First well, I learned from young people and from people serving young people. So I just have a few quotes here about this power dynamic. Riviana Hyatt, who has done a lot of work, but started her work as a young person with lived experience with the National Youth Forum. And when she was an outreach worker, like one way to think about this power dynamic is you literally have the power to decide if someone gets one juice box or two, right? So that power dynamic is there and it's real. And we always need to think about that when we're doing this work, even though it's hard, especially with folks who are experiencing multiple barriers to stability. It's not to say that this is not hard work. It's just to say we have to think about where the burden lies, and it shouldn't lie on the person experiencing homelessness because they are already in crisis. One of the things about our field is that we often come from a place of paternalism. And in the youth homelessness field, you'll hear that called adultism, but it's just assuming that we know better what people experiencing homelessness needs, and that we need to, they need to follow the path that we set for them. So Housing First really shifts us away from that and lets them take the lead and we walk alongside them. And finally, this burden for engagement, right? Often here when services are voluntary, how do we make folks engage with services? People won't engage with the services that I'm offering. Again, let's shift the burden there for if someone's not engaging with services, instead of saying what's wrong with them, say, what do I need to do to change the way I'm offering these services? Maybe the services that you're offering is something that someone is not interested in, right? I often think a lot of our field could improve if we just came at this from a customer service perspective. I did a lot of years in hospitality industry. And I think it made me a better case manager, right? Just saying, how can I serve you? What do you need from me? Let me check the chat real quick. And folks in the audience, Jacqueline's there. I don't see any. Oh, is that someone? Yep. Okay. Introduce yourself. I can't actually see you, but I can hear you.
Yeah, no problem. My name's Emily Hinton. I have a background in social work, and I do like that you put an emphasis on it's housing first, but then support services. But I'm wondering, what do you do when you get someone in housing and those support services aren't available? Resources in California feel really limited. So I'm just wondering, like, do we not do housing first then if there's not the support after? Because
Yeah.
is housing first effective without the support?
So all of the data indicate, again, I want to challenge us. Human brains work this way. We tend to remember the really hard cases. We tend to remember the problematic ones. And there's a particular cognitive bias that does this that I can't remember the name of. And then we assume that all the people are like that, right? The data really clearly indicate that most folks experiencing homelessness actually just need housing assistance for a short period of time, and they're okay and they don't return to homelessness. There's a smaller group of folks that I think are the ones that stick out for us because they're the hardest to serve and they do need a lot of resources, right? So having said that, just because you haven't built a good enough system yet to be able to do that kind of cross-system work with the mental health and behavioral health system particularly, doesn't mean that you leave folks outside. Like that can't be okay, right? Like the alternative is not to leave folks outside. So some of this is, there are ways to do this. We know there are mental health resources, negativity bias. Thank you, Ethan. There's also confirmation bias in there somewhere too. So we know we have in our communities, Riverside County actually in California is the only community in California that's ended veterans homelessness. So I always like to hold up Riverside. If anybody, is anybody on the chat or anybody in the room from Riverside? So Riverside County is into veterans homelessness. And so it's always a really great example of the right things to do. It's not an entirely fair analogy because the veterans system is so much more heavily resourced. But what we've learned from the progress on veterans homelessness is that you have these two systems, more than two actually, but particularly the housing system, the HUD-BASH, right? Like the housing, the PHA and the Veterans Administration. Getting those two systems connected didn't happen overnight. And in a lot of communities, they're still struggling. But in places that ended veterans homelessness, it is because they did that really hard work to build that cross-system partnership and to make sure that veterans experiencing homelessness were able to get connected to not just the housing, because the housing is there and folks are getting into housing, but making sure that they have the resources that they need once they're in housing to stay housed. So that's not a satisfactory answer to your question. And again, I don't want to downplay that this is not easy work. It is really, really hard, especially for folks who are experiencing a lot of barriers. We know we need more mental health and behavioral health resources. Those systems are out there. Those systems also got a lot more funding for coronavirus, right? Like, we have to do better work connecting those two systems and the larger healthcare system. So I think the answer is you just don't leave folks outside ever. Like that can't be an okay response to leave folks outside. And then we have to figure out how to build better supports and get folks connected to better supports while maintaining that housing first orientation. Any other questions, thoughts? Someone asked, what happens for a resident that does not succeed in a PSH for being too disruptive for other residents and stuff like that? So those are really good questions. You can maintain a housing first orientation. The reason why we start thinking about it as a philosophical approach and not just a particular program is that it's like you're starting from a place where you say, as a program, as the staff, as a community, as a state in the state of California, we are committing to, we don't return people to unsheltered homelessness, right? So that doesn't mean that no one ever loses housing for all the reasons that any of us might lose housing, right? Like I'm a renter. And if I go downstairs and berate my downstairs neighbor, you know, there may be consequences, natural consequences to that. I have enough resources that if I did get evicted, I wouldn't become homeless. Someone who is in PSH, if they are going to experience the consequences of that, we want to make sure that we are able to connect them to resources so they don't become homeless again, right? So it's just about committing to that at an agency level, but also at a community level. I have a really great example. Again, a lot of what I've learned from youth providers who made the shift to housing first. And this was a traditional kind of transitional housing program with high barriers to entry and required services and P-tests and curfews and all of that kind of stuff. And they really made that shift. And part of the shift that they made when they were redoing their entire mission was to say, we commit to, even if a young person doesn't stay in this particular housing situation anymore, if something goes wrong, something goes sideways. And by the way, whatever is sideways, it needs to be a really, really few things that are particularly about safety, and not just a lot of other things that are just stuff that we use to kind of control troublesome people. But if something like that happened in this program, they committed to, we may need to sometimes have young people not stay here anymore, but we are committed to finding somewhere else and not to putting that young person back on the street. That may have been family reunification stuff. That may have been a treatment program. That may have been, in very, very few situations, they were also committed to this too, as a matter of restorative justice. That may have been involving law enforcement, but that was like a last option. But still, they said, like, the only option we will not do, we are committing to this as an organization, this is really embracing housing first, is we're not going to return this young person to homelessness. Lorena asks in the chat, what can we do when residents refuse the resources that are available or refuse to take medication and continue to disrupt and trigger neighbors with their behavior? So I think, again, this is one where we can set a base level of commitment and say, okay, if this does happen, what are we committing to as an organization if we embrace housing first? Is it going to be that we exit someone back into homelessness? No, that's not an option. So what are some, so then we have to brainstorm as an organization, what are some other options? Are there things that we can do in the context of a resident, presumably in PSH, that is not meds compliant, right? Are there inpatient treatment options that need to happen? Are there mediation, special mediation programs that can happen between residents? Are there ways that we can support the neighbors who might be triggered to make sure that their triggers don't result in them presumably doing things that we think will be harmful for them, right? So I think it's a matter, Lorena, of, like, as an organization, having really hard conversations about what do we commit to as an organization about embracing this philosophy, and how are we going to handle these special situations. And again, thinking about the negativity bias, the confirmation bias, these situations are not the norm, even in programs that serve folks with what we think of as really high barriers to stability. Some of you may have heard me do presentations about emergency shelter, and it is a kind of a mythical lore now in our field, the Marvin rule, and whether or not this actually happened. And there was actually someone named Marvin, but when we have gone in and done trainings in my previous job with emergency shelters for lowering barriers, right? You ask people to look through their list of rules for residents in shelter, for guests in shelter. And you ask them to go through and say, are these about safety for staff and other residents? And if not, why are they there? And sometimes we get rules in place because there was one problem person. In this case, it was Marvin. And we decided because Marvin did a problem behavior, we're just going to make it a blanket rule for everybody that comes into the shelter. So depending on the version of the Marvin story that you've heard, it was either that Marvin brought a lighter in the shelter and was engaging in some extracurricular substance activity in the bathroom with the lighter and set something on fire. Therefore, nobody was ever allowed to bring a lighter into the shelter again. Or in other situations, Marvin wore a hat into the shelter and something, I can't even understand what might have gone wrong with the hat, but then because that went wrong with Marvin and his hat, nobody was allowed to wear a hat in the shelter again. Those are situations where it was particularly about this individual person, but we ended up making rules for the whole program and everybody involved in the program based on this one problem person, right? So again, it's not an easy answer when you do have that one problem person, what to do about it. But I think a lot of figuring out what to do about it involves coming together as an organization or as a community, right? And figuring out when we do have these rare situations, what are we going to do about them that allows us to stay true to housing first, but also keep ourselves and other people safe. Sonia, I see affordable housing providers build for low to very low income individuals, and not everyone fits into those categories. So with rents increasing, not necessarily income, are you aware of any new funding policies that will stop the flow of moderate income individuals from becoming unhoused and increasing the unhoused population over time? I think that the data that I know about on this may not be most recent, and I think COVID kind of throws a kink. Okay, a person in the room has that question. Okay, Jacqueline, hold on just a minute. So I think the people who are experiencing homelessness, especially unsheltered homelessness, are actually extremely low income folks. We don't have a lot of moderate income folks falling into homelessness, or if they do, they don't stay homeless very long. They're often still working, and it's a really kind of a one-off thing. You actually probably never even see them in your homelessness system. I think there are resources available, like we talked about with the COVID resources, a lot of these COVID rental assistance resources, and there are many, many more that are beyond just EHV and ERA, are available to folks at higher than extremely low income levels. So if you're thinking about in your community ways to assist those folks as a prevention mechanism, it's about moving beyond just the homelessness specific resources, which by the way, do have extremely low and extremely low income requirements on them. Jacqueline, someone in the room had a question?
Hi, my name is Elijah Pierce. I'm an
Elijah.
architect. Hi. I'm an architect and been designing a lot of PSH units the last couple of years. A lot of funding coming down for that. But the project types have been varied. So we do some small scale PSH projects, large scale, upwards of 80 PSH units together. Sometimes there's a cluster of PSH units scattered in a larger affordable housing complex. We've done a co-housing PSH project. Is there literature out there that might guide us or our clients to more successful models? Right now, it kind of feels like a crapshoot. We're doing a lot of stuff, and it's great. It's better than what we were doing before, which was not a lot. So it's been good, but it does feel a bit random right now. We're trying out PSH in every shape, form. Mm-hmm. I'd love to know if there's anything out there that we could point some of our clients towards, saying, hey, these are some successful models that have some data behind them.
So Elijah, I will ask you to email me or ping me on the Whova app so I can send you my email. Because I can give you more resources just on PSH research in general. The research in general is that PSH is really, really effective. I don't know that anything has gone in and drilled down between congregate PSH, where everybody in it is someone who experienced chronic homelessness, scattered site PSH, right, which exists, which is just people with a voucher and services, but they're in regular housing, some kind of hybrid model, small, large. Like, I don't know that anybody's done research comparing those, but if you'll ping me about those. This is just Mindy talking off the top of my head. I think there may be a group of folks, and that might be folks with serious mental illness and or cognitive delays, who benefit from a really kind of structured group environment. I think sometimes when we think folks need that structured group environment, we might be bringing our biases and not necessarily what the evidence says. I think there are a lot of folks who can benefit from just housing out in the community, as long as the services are there, right? As we've talked about before, like, it's really important to make sure that housing first is not housing only. So if there's a group of folks that really do need that kind of on-site, high level of services, that makes sense in a group context. I think there are a lot of other folks that can benefit from the other models. But again, I don't know that there's been a research project that compares different PSH models and outcomes on that. The general research on PSH is just outstanding.
Great. Thank you.
Yeah, and ping me, Elijah, ping me on the Whova app. John in the chat says, the question is a good one regarding system perspective issues. Concerned that PSH requires a high level of service, and service jobs don't pay much. Amen. So there isn't enough housing available to house the people needed to provide the services with PSH, especially in high cost areas. Absolutely. And I always worry when we're having this larger system level good policy conversation, I don't want to seem like I'm dismissing the difficulty, the incredible difficulty of doing this on the ground, especially in communities where the affordable housing crisis is so bad, which is many of the communities in California. So John, absolutely, that's a big piece of the puzzle that's missing. There are things that the homelessness system can do, and that's in the control of the homelessness system. There's things that have to happen at the larger community level beyond that crisis response system, and the affordable housing one is a piece of that. I think one of my colleagues here at Home Base talks about, there is the where we want to get to, and the community that we're working towards, and the housing market that we're working towards, and that's why we're all wearing our advocacy hats. And there's the housing market that we have right now, and the people experiencing homelessness that we have right now, and how are we going to make this work, right? So one of the things that comes up, especially in high cost areas, is shared housing. It is how everyone who is low income in your community is probably making housing affordable. And it's something that we need to make sure that people who are experiencing homelessness also have access to, so that their housing can be affordable. There are good ways. I think you guys have, Chris Freed is doing a shared housing workshop at the Housing California conference today. So if that's not conflicting with right now, make sure you go to that, because there are really good practices for making shared housing work, including with folks that we think of as those high barrier folks who won't be able to be stable. One of the benefits of shared housing, if you can make a good shared housing match, is it provides that social support, right? And then where the service jobs not paying much, that's another issue with our advocacy hats on. I think one of the things that we've seen with the pandemic and the Great Resignation and folks having extra funding to pay for new folks is that they're paying them higher wages. So that's also a part of what we should be pushing for. Okay. I'm going to go ahead and move on just really quickly. Again, I am not going to get through all of these, but since it was brought up, I want to talk about coordinated entry. And I think for all of us, this has been something that there is a lot of misunderstanding about, There is a lot of bad coordinated entry happening in communities, but I just want to talk about the why of coordinated entry. It's related to this systemic approach to homelessness thing. So one of the things that we think about with coordinated entry is, again, how things used to be. And it used to be individual programs doing their own thing, deciding who got into their programs and who didn't. And no shade to any of us, because this is hard work. It was very often the people who got into the programs were the ones who were able to jump through hoops, who had fewer barriers to stability, right? And sometimes that was just because that's easier to do. Sometimes it was because our funding streams created perverse mechanisms to cause us to want to cream. And so the reasoning behind coordinated entry is we want to make sure that everyone has fair access to all the programs in our communities. And if that is happening or not happening in our communities, that's because we're not doing it in an effective way, but it doesn't mean that we should lose sight of the why of coordinated entry. So again, we wanted to be a more streamlined and transparent process of getting access to homelessness assistance, both the crisis response and the permanent housing. What would often happen as a result of the way things were done before is there would be a disparate impact on people of color because of those larger systems that had themselves racial disparities, right? Oh, is it over? I thought I had until 12:30. I am so sorry. Thank you, Jacqueline. Okay, I won't keep anybody any longer. And again, I'm really sorry, you guys. I had it on my calendar till 12:30 and I was just going to stop. So all of these resources will be available to you on the Whova app. Thank you so much, everybody. Reach out to me anytime. Let me... Bam, 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 bam. So much stuff in here that we didn't get to, but I'm happy to talk to you all about all of it, especially folks who are brand new to this field. We all were brand new to this field at one time. So, and it's a great field to be in, and you are really having such an impact on the people who most need assistance. Thanks, everybody. Reach out anytime.